Welcome to a new era of healthcare education, where large language models, or LLMs, are revolutionizing the way we learn, understand, and apply medical knowledge. These intelligent systems are the vanguard of the future, enhancing the learning experience for healthcare professionals everywhere. As we move into 2024, here we cover 24 LLMs that we definitely need to watch in the coming year. These are not in any particular order, and vary widely in how they can impact education. This video also intentionally avoids the use of ChatGPT, so that is what you are interested in. Click this video in the top right. YouTube is driven by a large dataset too, and it would really help our channel if you subscribed, gave this video a thumbs up, and tell us what LLM you are most excited to watch next year. First up, we have MedPalm from Google AI. MedPalm is a powerful LLM trained on a massive dataset of biomedical literature and clinical information. It can answer complex medical questions, generate different treatment options, and explain medical concepts in layman's terms. MedPalm can be a valuable tool for medical students, residents, and even patients seeking to understand complex medical topics. Imagine it as a virtual medical tutor, providing personalized explanations and answering specific questions about diseases, treatments, and medications. Next, meet Jurassic 1 Jumbo from Microsoft. This impressive model excels at medical tasks, achieving near-human accuracy on challenging exams like the USMLE Step 3. It can summarize research papers, generate study materials, and provide differential diagnoses. Jurassic 1 Jumbo can be a powerful self-assessment tool for medical students, helping them identify areas for improvement and prepare for exams. It can also be used to create personalized learning materials, tailoring content to individual student needs and areas of difficulty. Florence from NVIDIA is another game changer. This LLM specializes in analyzing medical images and generating corresponding reports. It can identify abnormalities in X-rays, Connecticut scans, and other medical images, aiding in diagnosis and treatment planning. Florence can be a valuable tool for radiology residents and practicing clinicians, providing insights into image interpretation and improving diagnostic accuracy. It can also be used to create interactive case studies for medical students, allowing them to learn from real-world examples. Then, there's EMR-to-CGN LLM from MIT. This innovative model excels at extracting structured information from electronic medical records and converting it into computable graph networks. This allows for better analysis of patient data and the identification of hidden patterns for research and personalized medicine. EMR-to-CGN LLM can be used to provide healthcare students with hands-on experience in analyzing real-world patient data. It can also be used to create research projects and simulations, allowing students to explore the potential of artificial intelligence in healthcare. Ada, from HealthOvation, is trained on a dataset of medical textbooks and clinical guidelines. Ada is designed to answer patient questions directly. It can provide clear and concise explanations of medical conditions, symptoms, and treatment options in a way that is easily understandable for patients and their families. Ada can be used as a simulated patient interaction tool for students, allowing them to practice communication skills and learn how to effectively explain complex medical information to non-medical audiences. It can also be used to create patient education materials and resources, as well as provide personalized learning plans, adapting to the learner's pace and style. It's a tutor who understands how you learn best. Our journey continues with Babylon from Babylon Health. This LLM focuses on personalized healthcare by analyzing individual patient data and generating tailored treatment plans and prevention strategies. It can consider factors like lifestyle, family history, and medication use to provide truly personalized recommendations. Babylon can be used to simulate personalized medicine scenarios for medical learners, allowing them to explore the challenges and opportunities of this emerging field. It can also help students understand the importance of considering individual patient factors in treatment decision-making. iDoc from the University of California, San Francisco specializes in analyzing and summarizing medical documents, including research papers, case reports, and clinical guidelines. It can quickly identify key information and provide concise summaries, saving healthcare professionals and students valuable time. iDoc can be a valuable tool for medical students struggling with complex research papers or medical textbooks. It can also be used to create interactive learning modules, allowing students to focus on specific topics and quickly grasp key concepts. Hippocrates from Stanford University is an LLM focused on clinical decision support. It analyzes patient data and medical evidence to suggest potential diagnoses, treatment options, and potential risks. It can act as a second opinion tool for clinicians, offering additional insights to inform their decision-making. Hippocrates can be used to create clinical case studies and simulations for medical students. By presenting students with challenging clinical scenarios and allowing them to explore different decision-making strategies with the support of Hippocrates, they can develop critical thinking and problem-solving skills. Centaur is another LLM from Stanford University, and it excels at medical image analysis and diagnosis. It can analyze X-rays, Connecticut scans, and other medical images to identify abnormalities and suggest potential diagnoses, aiding radiologists and other healthcare professionals in their work. Education applications. Centaur can be used to create interactive modules for medical students learning about medical imaging interpretation. It can also be used to generate case studies where students analyze real-world medical images and compare their findings with Centaur's suggestions, fostering critical thinking and diagnostic skills. DrAI specializes in personalized healthcare, analyzing individual patient data to predict risks, suggest preventive measures, and offer tailored treatment plans. It can consider factors like genetics, lifestyle, and medical history to provide proactive and personalized healthcare advice. DrAI can be used to simulate personalized medicine scenarios for students, allowing them to explore the potential of proactive and preventative healthcare approaches. It can also be used to teach students about the importance of considering individual patient factors in healthcare decision-making. Infermedica focuses on symptom checking and differential diagnosis. It analyzes patient symptoms and suggests potential diagnoses based on medical evidence, helping patients understand their health concerns and seek appropriate medical attention. Infermedica can be used to create interactive tools for students to practice their diagnostic skills. It can also be used to teach students about common medical conditions and the differential diagnoses associated with various symptoms. MedGNet excels at natural language processing in the medical domain. It can understand and generate medical language, translate medical texts, and even write clinical reports. It can bridge the gap between technical terminology and layman's understanding. MedGNet can be used to create interactive tools for medical learners to practice medical communication and documentation skills. It can also be used to translate complex medical texts into easier-to-understand language for both students and patients. LumiSight specializes in visualizing medical data. It can convert complex medical data sets into interactive visualizations, making data easier to understand and interpret for healthcare professionals and students. Think of it as a data translator, transforming numbers into clear and insightful visuals. LumiSight can be used to create interactive data exploration tools for medical students, allowing them to visualize and analyze real-world clinical data. This can help them develop data interpretation skills and gain a deeper understanding of medical trends and patterns. Ada Health focuses on mental health support. It can assess mental health risks, provide personalized coping strategies, and even connect patients with relevant mental health resources. Imagine it as a mental health companion, offering guidance and support for emotional well-being. Ada Health can be used to create simulations for students learning about mental health assessment and intervention. It can also be used to provide students with resources and strategies for supporting patients with mental health concerns. Surgeon from Johns Hopkins University is an LLM to assist surgeons in planning and performing surgery. It analyzes medical images, suggests optimal surgical approaches, and even simulates surgeries virtually. Think of it as a surgical co-pilot, providing insights and guidance for improved surgical outcomes. Surgeon can be used to create virtual reality simulations for surgical residents to practice and refine their surgical skills in a safe and controlled environment. It can also be used to visualize complex surgical procedures for medical students, enhancing their understanding of surgical techniques. GenomicsAI specializes in analyzing genetic data. It can interpret genetic variants, predict disease risks, and even suggest personalized treatment options based on individual genetic profiles. Imagine it as a genetic decoder, unlocking the secrets of our DNA for personalized healthcare strategies. GenomicsAI can be used to create interactive modules for medical students learning about genetics and personalized medicine. It can also be used to simulate scenarios where students analyze patient genetic data and propose personalized treatment plans based on their findings. LumiPath helps healthcare professionals navigate complex treatment pathways by analyzing clinical data and suggesting personalized treatment plans. Imagine it as a roadmap through the maze of medical options, offering a clear path for optimal patient care. LumiPath can be used to create case studies for medical learners, where they analyze patient data and recommend treatment options using the LLM's suggestions. This can help them develop clinical decision-making skills and learn about personalized medicine approaches. Dxplain excels at explaining medical diagnoses and treatment options in a clear and understandable way for patients. Think of it as a medical interpreter, bridging the gap between technical jargon and patient comprehension. Dxplain can be used to create patient education materials and tools. It can also be used to augment medical learners in communication skills, helping them effectively explain complex medical information to patients in a way that is both accurate and easy to understand. MedCoder automates medical coding, analyzing patient records and assigning the correct medical codes for billing and insurance purposes. It tackles a tedious and error-prone task, improving coding accuracy and efficiency. MedCoder can be used to create interactive exercises for medical learners and coders, allowing them to practice assigning codes to simulated patient records. It can also be used to generate feedback on coding accuracy and highlight common coding errors, fostering mastery of this crucial skill. I don't know about you, but this was not a skill I have seen schools or residency programs spend much time on, but it is a major part of getting paid for clinical work. Nursebot assists nurses with documentation, patient monitoring, and communication. It analyzes patient data, generates nursing notes, and even provides alerts for potential complications. Think of it as a virtual assistant, easing workload and enhancing patient care. Nursebot can be used to simulate nurse-patient interactions in a virtual environment, allowing nursing students to practice communication and documentation skills in a safe setting. It can also be used to generate realistic clinical scenarios where students make decisions and manage patient information under simulated pressure. EpiVITAL focuses on predicting and preventing epidemics. It analyzes real-time data on disease outbreaks and suggests interventions to mitigate their impact. Imagine it as a global health watchtower, keeping us one step ahead of emerging threats. EpiVITAL can be used to create interactive simulations of disease outbreaks, allowing public health students to practice outbreak investigation and response strategies. It can also be used to generate scenario-based exercises where students analyze data and propose interventions based on specific epidemiological patterns. PharmacoAI helps healthcare professionals make informed decisions about drug prescriptions. It analyzes patient data and medication interactions to suggest the safest and most effective medications for each case. Think of it as a personalized drug advisor, optimizing medication choices for individual patients. PharmacoAI can be used to create interactive modules for pharmacy students, simulating medication prescribing scenarios, and allowing them to practice assessing risks and benefits based on patient data and drug interactions. It can also be used to generate case studies where students analyze complex medication histories and recommend appropriate treatment plans. PsychAI assists mental health professionals in diagnosis and treatment planning. It analyzes patient data and speech patterns to identify mental health conditions and suggests personalized therapy plans. Imagine it as a mental health co-pilot, supporting and augmenting the expertise of therapists. PsychAI can be used to create simulated interviews and therapy sessions for mental health-focused learners, allowing them to practice diagnostic skills and therapeutic interventions in a virtual environment. It can also be used to generate case studies where students analyze patient data and propose personalized treatment plans based on psychopathological patterns. BioNLP excels at extracting key information from clinical narratives and electronic health records. It bridges the gap between unstructured text and actionable insights for research and patient care. BioNLP can be used to create text analysis exercises for medical students, where they extract relevant information from medical reports and research papers. It can also be used to generate interactive case studies where students analyze patient narratives and identify key clinical findings, enhancing their comprehension of medical documentation. And there's more LLMs out there. This list can get you started finding some incredible tools, but it is not an exhaustive list. Each LLM brings a unique approach to enhancing healthcare education. These 24 LLMs are pushing the boundaries of healthcare education. From Google AI's MedPalm, which summarizes medical text, to BioNLP, which helps make sense of complex biomedical information. Each LLM is shaping a future where medical knowledge is more accessible and digestible. They are not just tools, but partners in education, enhancing the learning experience for healthcare learners everywhere. So as we step into 2024, let's remember these LLMs. They are not just names or algorithms, but the future of healthcare education. They are the guides in our journey of learning, the torchbearers of a new era. Welcome to the future. Thank you for subscribing for our healthcare education and simulation content. Please check out this video the YouTube AI really thinks you should watch next.